So this recommendation might be a little bit controversial. I'll give you a little bit of background. A few days ago, the French health minister, on the support of a French physician, said that it seems as though the use of non-steroidal anti-inflammatory drugs, which are commonly used for pain, inflammatory conditions like arthritis, and to reduce fever. So some common names would be ibuprofen or naproxen. Uh, there seemed to be an association with a higher risk of complications in people with COVID-19 who had used these types of medications to treat fever and symptoms. So 2 days ago, the WHO recommended against using nonsteroidal anti-inflammatory drugs, as well as cortisone, which is used in some countries to treat fever, if you have symptoms of COVID-19. And it's just worth noting that this is controversial because the science really isn't there for this recommendation yet. And earlier this morning, the WHO withdrew that recommendation and said they're still evaluating the science behind whether there's an association between these drugs and worsened COVID-19. So the WHO no longer recommends against using these medications. However, it is worth noting that NSAIDs have also been associated in large epidemiologic studies of patients with IBD. NSAIDs have been associated with flare-ups of IBD. So in general, I think most of us recommend avoiding NSAIDs in patients with IBD, nothing to do with COVID-19. And so it's prudent, if you can avoid NSAIDs, to avoid them. But again, the association with COVID-19 is uncertain at this point in time.